Good morning. Thanks, Steve, for the nice introduction, and thanks for the invitation. We're going to change topics completely now. You think sports medicine is about injuries. We hear of muscle injuries, hamstring, LCLs, and illness is not so much on the agenda for sports medicine physicians, or even to speak of surgeons in this part of the world. But if you look at the data, think twice, and this is what we're going to do. We're going to talk a little bit about illnesses and injuries. I'm going to try to explain you the specific situation we have regarding illnesses in the GCC, and I'm going to try to outline an illness prevention strategy that you might be able to use in your club or your environment. Now, illnesses versus injuries. A good sportsman physician, he knows how to treat an ACL. The surgeons know how to operate it. What about illnesses? Is it that common? It actually is. You know, if there's plenty of studies in various sports, you know, a couple of them are cited here, one by our chief of sportsmen, Juan Manuel Alonso, done in the IAAF. There's a couple of football studies. There have even studies on the America's Cup, where it comes out, and the bottom line is that you will see, as a team physician, 1/3 of illnesses, mainly respiratory or gastrointestinal illnesses, and 2/3 of injuries, hamstrings, ACLs, and so on. So the illnesses are relatively common, and they have an impact on your team. Maybe not so much in football, because you can obviously play with an upper respiratory tract infection, and the performance of your team will not be impaired that much. But imagine you're an athlete competing in an individual sport, a runner, a cyclist, a rower, and you have an upper respiratory tract illness on the day of your most important competition. That's it. You're not going to win a medal, that is for sure. So you better have that on the topic. The occurrence of illnesses is obviously depending on many different factors. It's a little bit like the ACL injuries. You see them more commonly in female athletes, less commonly in male athletes. The same applies to illnesses. They depend on the gender, on the environmental conditions, obviously, on the type of sport, and on the age of the athlete. So this is something you have to consider when we work on the prevention program, which I'm going to talk about later. Let's look now on the GCC situation. What's the GCC situation on illnesses in athletes? The answer is simple. We don't really know. We don't really know. There's no data until now, but, and you've seen the dots here, we're working on it. In the Aspetar program, in the Aspetar Injury and Illness Prevention Program, we're trying to get some data on it with the help of all the NSMP doctors, and many of them I see here in the room, and driven by our Karim Schumacher, he is here in the audience. We're working, trying to collect data on that and to fill that gap in the literature and try to better address this issue. We have some ideas, because I mentioned that the sound is getting really awkward here. Can you maybe regulate it down a little bit? Hello? Yes, thanks. I mentioned the environmental conditions that might influence the occurrence of illnesses in our athletes. And there's, in the GCC, as you know, there's several issues that we must consider in the framework. One is obviously the pollution. You know that many of the cities in the Middle East, this is not only Doha, it's also Dubai, it's Kuwait City, it's Manama, are among the most polluted cities in the world, unfortunately. I was very surprised when I heard that data, because I said, hey, it's an open space, there's plenty of wind, there's no big industry, where does the pollution come from? What is it, you know? And it's the things called particulate matters. Those are kind of small particles, mostly coming from engines of vehicles, that can go deep in the lung and cause tissue damage. What is this? Yeah, so you can see here on the graph the particulate matter of yesterday load in Doha. When it's green, it's kind of okay under a certain threshold. And if it's pink or red, it's not okay. It's above a threshold that is to be considered as pathological. And you can see that yesterday, there was quite some times, especially in the evening, where the particulate matter concentration was way above what is considered to be healthy. Now, these particulate matters, they go into the lung, they cause pulmonary inflammation, which will cause mucosal damage. And knowing that a lot of your immune system is somehow situated in the lung and kind of filters out all the bad stuff, that is impaired. And obviously you're way more prone to infection and illnesses if that system is not working properly. So this is one factor that we have to consider when we evaluate illnesses in the GCC athlete. Another one, and that has some historical perspective, is maybe a little bit outside of the real realm of sports medicine, is the global situation of Qatar. If you look at Qatar on the world map, which you see on the upper right corner of that graph, is Qatar somewhere in the middle of the world, you know? So we have many people coming to Qatar. The population is very heterogeneous, you know? So there are people coming from Southeast Asia, from Europe, from America. You all come to work here. And these people have differences in immunity. They have different infectious diseases packages, as researchers shown them. Our immune system is more or less a blank page when we are born. And it gets kind of formed, programmed through our adolescence, when we are child, to the environment that we live in and that we work in. So if you you're born in Southeast Asia, your immune system is completely different to your immune system when you're born in the Gulf or whether you're born in Europe. And you're also exposed to different germs, different viruses that you're able to deal with. So, and when you come to Qatar, you bring with you some of these germs, some of these viruses, which you then transmit to people who come from other areas of the world. And this is also why the observation that we have in our clinics, that many of the respiratory tract infections that we see here in athletes, in our athlete clinic, are way more severe than what we would see in our country. And this is probably due to this situation and maybe to the pollution. So this is the theory that I'm sharing with you, so that it's not published anywhere, but we have a good body of literature that supports this. Think of the phenomenon of thalassemia. Thalassemia is very common in the Gulf. And why is thalassemia very common in the Gulf? Because it protects you against malaria. So if you have thalassemia, you're less likely to get malaria. So all the people with thalassemia over the ages have been out-selected compared to other people that didn't have it and then who were dying of malaria back in the old days. This is many generations ago. This is well documented in literature. So all the Mediterranean countries, all the countries in Africa, lots of people with thalassemia. Northern Europe, no thalassemia, because obviously there's no malaria and they had no advantage genetically to survive. The same applies, to when foreigners came to America and to South America. The Indians in America and South America died of diseases that were not causing any problems to Europeans who brought them, smallpox and measles. So the big drop in population in America and South America back in the 14th, 15th century when these countries were colonized were due to infections that were the immunity of the people who lived in that country were not ready to handle. And we also have now newer evidence that even in the prehistory, our ancestors, the Eurasian man in the prehistoric times, won over other species like the Neanderthal man because they gave them infections that the other populations were dying. It was just published now in 2016, is all genetically proven. So this, on a much smaller scale, as I explained, might influence the immunity and the way to deal with infections that we encounter here in the GCC. Now, if we obviously have a problem now, let's try to develop a little bit of an illness prevention strategy. You all know that you might remember this picture that we saw yesterday that from Professor Roald Bauer, where we kind of try to classify the injuries and the medical problem that we have according to occurrence and severity, and whether if a problem is very frequent or very severe, then prevention strategy actually makes sense. So this is what you saw yesterday. You know, you have the very rare events like sudden cardiac death, but which are pretty severe, so you better do something about it. And then you have the ones that are kind of in the middle, like hamstring injuries, which are very common, but relatively severe, as we have seen in the previous talk. And I would probably classify the illnesses somewhere below the hamstring injuries. This is very common. and it's potentially very severe in terms of their significance in sport. But the good news is that it's pretty easy to prevent. There's pretty easy strategies to go with this, to deal with this. It all comes down to the immune system. When we try to make up a model, illness prevention model, it comes down to the immune system and the impact all the environment has on the immune system. The immune system is not something fixed, it can be changed. Obviously, there's pathogen exposure that will change your immune system. The more you are exposed to pathogens, the more problems you will have. Your immune system is influenced by stress. I just saw a staff member this morning with an upper respiratory tract infection in my clinic, and she said, yeah, I had to travel, and then I had family problems, and this is why she fell sick. She got this respiratory infection. We all know the situation. But the biggest impact on the immune system and the athlete is the load between training and recovery. You've heard that before. You've heard that yesterday in the talk about training load and the risk of injuries. And I must say, in internal medicine, we have known this for 20 years. We have known this J-shaped curve that is now just emerging in musculoskeletal medicine since 2000, where we know that the danger of infection, which is here the blue line, changes from moderate to excessive exercise, where the moderate and little bit of exercise is actually good for your immune system. Excessive exercise is actually bad for immune system and increases your risk of infection. So with this in mind, we can now try to build a system where we modulate these different factors and mitigate the risk for upper respiratory tract or gastrointestinal infection. And it's actually pretty easy. We can work on the immune system and first of all identify predisposing factors. Do people have things that impair or increase the ability for pathogens to enter the system? Do they have asthma? Do they have pre-existing diseases? This is what we try to do in screening, in athlete screening, like we've heard from Steve yesterday. We can, we can, and this is most important, we can try to manage the coach with the training and recovery, balance and training of recovery, monitoring and loading, and try to increase recovery times to improve the immune system. And we can obviously, and that's the easiest one, manage pathogen exposure by vaccination of our athletes, by implementing a hygiene program, and by isolation of the athlete. Isolation means not only to isolate team members once they are ill, it also means isolating yourself from potential pathogens. The classical example is you're a famous athlete and then everybody wants to shake your hand, of course. Stop that. Every handshake transmits germs. If you speak to a journalist who might have an infection, keep a safe distance. Have your athlete keeping a safe distance of 1 meter so that there's no droplet transmission of these germs. So these are easy measures that you can implement in your team to improve the function of your immune system. Of course, there's other factors that you can also modulate. You can improve the sleep quality, you can improve nutrition, which will impact all these factors. Now, if there's 3 words that I want you to remember to implement the strategy is, first of all, isolate, wash, and recover. Isolate yourself, what I mentioned before, from potential germ exposure. Try to isolate your gear if you have drinking bottles, if you have tennis rackets or other balls that you play with, try to isolate them in order to limit the pathogen transmission. Isolate infected team members. Wash yourself, your gear and your food to avoid transmission. The easy way is to carry a little hand gel in your pocket and every now and then kind of clean your hands. And try to recover physically and mentally to give your immune system a chance to battle all these infections. Thank you very much for your attention.